Hello, ladies. How are you? This is Beverly with Beverly Hills Health and Wellness Coaching. I am here to have a little chat. It's not our normal coffee chat day, but I'm always having coffee in the morning. It's still pretty early for me. I've been doing a lot of training, so I was on a little break and I thought, you know what, let me take this opportunity to jump on and have a short conversation because I have to jump back in to my training. But I have this master class that's coming up very soon now, days away, May 21st, 2024. I'm looking at my calendar, make sure I get the date correct. So, which is a Tuesday at 6 p.m., where we're going to be taking a deep dive on sugar. So, I've been doing a series of just pop-ins on sugar. I actually did a training a couple months ago on Slimmer Sexy You, and there were so many different subjects I talked about, which also include a full day on sugar. So this will be a very condensed version. It will only be about an hour of content, and then I'll go into question and answers. But I really want to serve you. Sometimes it's really difficult for the ladies to show up for a whole week of training. So I decided to do something pretty compact and serve you in a way that you can really move the needle. Okay. So let me do a formal introduction and then I'll talk about sugar a little bit more. So I'm Beverly with Beverly Hills Health and Wellness Coaching. I'm a certified health coach and I'm the founder of the Body and Lifestyle Academy, where I help women to lean into a fabulous, confident, sexy new vision to themselves as they break through the stigma of menopause. Like we can step into a powerful next level life. Okay. So let me look at my notes for a second. This is going to be really short, I promise. Sometimes I say it's short, it goes on for like 15 minutes, I promise. A couple of minutes here, tops. But I wanted to ask you if you know your numbers when it comes to your body. We talked about like some of the things that show up when we're not tracking what's happening in our health. And one of the ones that is really significant that I don't think I've talked about with you ladies here, but I'm going to do it today. And it is about this little jewel right here. This is a really great way to track your number. So the measuring tape is a way for you to determine the circumference of your waist and see like what type of health you're in. There's like 3 different categories that you're in. Of course, it's like it's very poor, you need to work on it, or it's like you're in a good place but it's not the best, and then there's like this optimal place. Okay, so number 1, to have this optimal health, your waistline should only measure, I would love for you to drop in the chat like what you think the number would be. I was kind of shocked. It's been a while since I've looked at these numbers, but the measurement for optimal health is getting closer. Okay. This is the number. I want to show it to you. This is the number. 31.5 is optimal health. So in my mind, I'm thinking this is 31 inches. Like this is the circumference of 31 inches. This won't even fit on my waist. I'm going to be honest. And actually, I will do a full disclosure. So if 31 is optimal health, if you have a waist measurement of 31.5, which I think is really on a very, 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 very slender frame, very slender. And what I want you to do is just be aware. I wouldn't try to fit myself in a box, but be aware and do what you can to reduce the waist circumference because it's an indicator of your health. The second category, which is an intermediate range, and it's a concern or increased risk for health concerns, is that 31.5 inches going up to 34 inches and a half. So there's just a couple of inches difference. You think losing an inch on your waist definitely takes a lot of work. To lose 3 inches, you really have to be intentional and you have to really focus. So that's the intermediate range. It's like you're not bad, but if you start moving up toward that 35, then you're in the zone that's major concerns. So the high risk zone is 35 and above. 35 and above. So this would be the 35 from like the 31 and a half. Okay. So I'm going to do my measurements, and I would love for you to actually share what range you're in. I'm not going to ask for your numbers, but I'm just like, what range are you in? So I got stuff all around me. So this is mine, ladies. Oh, where am I? 32 and a half looks like. So for me to be at 32 and a half, that puts me at that intermediate range. It's on the lower end, but still, you know, check myself. I'm going to work on trying to drop another inch off. And one of the things that is so impactful in shifting this is reducing the fat. That's all this is. It's like I've been enjoying myself. It's the springtime, and you know, no excuses. Just need to work on it, tighten it up a little bit. But I feel like I was good, but until you know your numbers, you're not sure. You're just kind of winging it. So ladies, get your measuring tape out, tape measure, and check your waist and see where you fall on that range. And if it's not where you want to be, just know it's all fat. And it's the reason that it's there is that you're going through that perimenopause, menopause phase where your estrogen is just taking a nosedive. And it has a tendency to store fat in your abdomen. So that's all it is. But there's a way to get rid of it. One thing about fat is like we're kind of in this space where we can control it by what we're intaking and how we're intaking. And that's one of the things that I'm going to talk about is like sugar is the number one challenge that's preventing you from shrinking your waistline. And what's happening is sugar, if you're not doing something to burn it off, it's stored. And it goes into these fat cells that we all have. But these fat cells are, you know, minimal. But over a period of time, if you're not burning off this sugar, then you stick that little fat, that unburned sugar into the cells, and this accumulates, and the cell gets bigger and bigger and bigger and bigger and bigger, which ends up around your waistline. It's like on your arms, on your hips, on your, like sugar. All we gotta do is work on the sugar, ladies. It's that simple. I know in theory it can be a little challenging, but I promise you, if you work on a sugar detox, your taste buds will totally change. I worked with so many women through the detox, and they come with like, I don't know, I'm gonna do this because I know I need to, but I have a hard time giving up this or this or this or this or this. And then by the time they go through the program, they're like feeling better. They're just shocked how, I know one lady, she lives down south, and she used to have her, what's it called, sweet tea. Syrup to me is just not sweet tea, it's syrup. But she used to have her sweet tea all the time. She said, I ordered one after I had went through the program just to see how it would impact my body. And she said, I don't know whether it's like a supersize or something, but it was like a pretty big one that she ended up getting. And she said she got it and she sipped on it, and she was just forcing herself to drink it because it was so sweet to her. She said she had to throw it away. She had to throw it away. And it's like, honestly, you don't know how much better you can feel until you on the other side of kicking the sugar. Your taste buds will totally change after you go through a sugar detox, and you won't even want it. It will be like forcing yourself to take it. It's like those people who are, I guess, alcoholic, like if once they stop drinking alcohol, they're good, their life is good, everything is like great in sobriety. And then when they try to go back to drinking, they're forcing their body to take this in, then they get sick. And then their body acclimates, and then they're back to where they were. And sugar is the same thing. It is a drug, it is a toxin. And for us women on this menopause journey, it prevents us from being where we want to be with our health. Bottom line. Bottom line. Okay, I'm going to stop, but I just wanted to share that. Let me know in the comments, like, where are you? Are you on the low end and you're good to go? I would say these would be high schooler kids. And you know what? I will even challenge that, because I've seen some information on the level of obesity that's happening in younger individuals. Like, they're starting to show up with diseases that elderly people, high blood pressure, diabetes, these are like kids, you know? So probably an athletic person, I would say, can really fall into that 31. But then understanding, like, they're very active usually. They're doing something to burn off that sugar. And that's the problem. We're not as active as we used to be. So our body's just like, okay, I'll just hold on to that for you. So just know, okay, if this is my goal, I need to change some things. So are you in the low category where it's optimal, it's 31.5? Are you in the intermediate where it's 35.5 to 34.9? Or are you in the higher range, which is a major risk factor? I'm going to tell you a couple of the risk factors. Then I got to go. I see my meeting is starting. My training has started back. Abdominal fat shows up as cardiovascular diseases. It shows up as metabolic problems, where you have problems like burning fat to lose weight. It shows up as type 2 diabetes, inflammation, and it goes on and on and on. Just doing that one thing turns this all around. So we want to be the slimmer, sexy version of ourselves as we go through this menopause journey, and it's so doable, so doable. You just need some support in getting there. And I am happy to provide you some skills, some knowledge, and some practical things that you can do to turn this around. So join me on my masterclass. It is May 21st, just days away at 6 p.m. It's not going to take very much of your time, but it will be worth your hour at least to be there, to take this information, and you can totally shift your health. You can totally shift any challenges that you're dealing with when you get on that scale and just like, you know what, this is ridiculous. Or if you're just like me, I'm going to get this inch off my waist. I'm going to get this inch off my waist. We should almost do a challenge. I'm not really good with challenges. It's just like, I'm going to do it because I said I was going to do it, because I want to do it for myself. But it would be really great to know if there's any of you here who are interested in being a part of something like that. But anyway, I have to run, ladies. I have to jump back into my training that is kicked off. I just love being with you so much, and I just want to share and want to encourage you and let you know, whatever you're going through, you can definitely get on the other side of this by taking control of how your sugar intake is ruling your life. It's an addiction, and it's not your fault. It was by design. These corporations have sneak sugar in everything that we have, pretty much. So let's get smarter and wiser and take our power back. All right, ladies. Well, I gotta run. Take care. All the information about registration should be like in the comments, or if this shows up on Instagram, sometimes I post it to Instagram, it will be in the bio. And you know what? You can always DM me. All right, ladies. Take care. Have a lovely day. We'll see you next time. Bye.